Hey guys, welcome back to my channel. Today I'll discuss about Foxy guidelines on vaccination in women. Okay, so first thing is introduction. So we all know, every year there are about 3.5 to 5 million people suffering with diphtheria, tetanus, pertussis, influenza, measles. Okay, almost 3.5 million people. Okay, and in India there are about 3 lakh new hepatitis cases where 40 million people are of hepatitis B, S, HbSAg antigen carriers. Okay, in this chronic hepatitis B, there is 25% percent of chance of turning into liver cancer. So we should vaccinate uh, before not to get the disease. Okay. So uh, pre-immunization checklist. So women who are vaccinating, they should have some checklist where it should say what are the contraindications and what are the precautions before the vaccine. This is the checklist. First thing, if a woman comes for vaccine, we'll ask whether she is having any fever, okay, any recent sickness. You will ask about any allergy, any serious reaction to the vaccine, okay, any severe allergy, okay, any live vaccine the last month, then we'll avoid that. Again, the another live vaccine in between months, okay. Recent immunoglobulins or blood transfusion, any history of low immunity, is she pregnant or is she want to become pregnant, okay. These history you'll ask the patient, then only you'll proceed for vaccination. So this guideline includes women, so adults and girls also come in this. So adults and girls are 13 to 19 years. So we'll give two vaccines for them. One is HPV and other is tetanus and diphtheria. Tetanus and diphtheria will give as a form of TD or it can be given as Tdap. These are mandatory vaccines. Okay. Other vaccines are optional. Certain vaccines are optional and should be administered if they're not taken in their childhood, like MMR, varicella, typhoid, hepatitis A, B. Okay. And if certain circumstances occur, then you'll give, so for example, dog bite or bat bite, then you'll give rabies vaccine. If the Japanese encephalitis infection is prevalent, then in that area, then you'll give this vaccine, meningococcal and a seasonal influenza vaccine. Okay, but these two, human papillomavirus and TD, diphtheria and tetanus, will give for it's a mandatory vaccine for adolescents. Okay, preconception period. If a woman, if she is in a reproductive age woman and she's not conceiving it in a recent time, then you can advise MMR vaccine. Okay, once she's taking MMR vaccine, she should not get pregnant within 4 weeks. Okay. Mm, and if the HPV vaccination is started, then schedule should be completed before she's planning to pregnancy. Pregnancy is 36 weeks of benefit for the baby if we give Tdap. Okay. See, vaccinations of the women, adolescents, pre-pregnancy, pregnancy, postnatal, and elderly. So I already told adolescents will give HPV and Tdap, and influenza, other vaccines you can give accordingly. Pre-pregnancy, you can give MMR, varicella, influenza, Tdap, HPV, and hepatitis B. In pregnancy, you'll give only two vaccines, that is tetanus and influenza. Tetanus and influenza. In postnatal, in general, all routinely recommended vaccines can be administered. In elderly also, you'll give tetanus and influenza like pregnancy, and they also give zoster and pneumococcal vaccine. Okay, postpartum. In postpartum, if the woman didn't receive MMR vaccine before, then can be vaccinated during the postpartum period. Okay, and if the woman is not previously vaccinated with Tdap, Tdap is not administered during pregnancy. Tdap should, if Tdap is not given in that pregnancy, then this Tdap vaccine can be immediately given in postpartum. If the woman skipped the HPV vaccine during pregnancy, then she should receive postpartum care as early as possible. Okay. Elderly women, I already told influenza and Tdap are given, and also they are giving herpes zoster and pneumococcal vaccine in special situations, like because if anyone around who is around this baby should be vaccinated in routine whooping cough vaccine, like if the surrounding situations are had prevalent of this disease, then you'll give accordingly that vaccine, flu vaccine according to the flu season. Okay. So I'm expecting vaccinations in adults and girls as question this time. So first you'll write what are adolescents, that is 10 to 19 years. Some people say 13 to 19 years anyway. So 10 to 19 years, and almost one-fifth of Indian women, Indian population is adults and girls. Okay, adult immunization is most important, most beneficial, cost effective in the adolescents. So, Universal Immunization Program and even Government of India guidelines says that age 10 years to 16 years, they should vaccinate to tetanus and TD. Okay. So, if you don't remember any vaccine, this TD is a vaccine which is given in all women, adolescents, pregnancy, lactation, even in elderly, everyone this TD vaccine is given. So, TD, that is tetanus and adult diphtheria vaccine is given. Um, HPV is preventive role is been the so WHO has been recommending the HPV vaccine to all adults in immunization schedule. Okay, influenza vaccines should be given, and also need to protect us against many diseases like hepatitis A, varicella. Okay, even adolescents are more prone for mumps and meningococcal infection. Um, so females receiving MMR infection is very important because this can transmit to the fetus in pregnancy. Mm, so in needles of to adolescents, there is no specific vaccination schedule in India. So IAP recommends separate immunization schedule for adolescents. Okay. Um, Vaccination in pre-conception period next. Same thing which I already told. If you are giving any MMR vaccine, they should not conceive within 4 weeks of vaccination. Okay, so yeah, in vaccination of adolescent, you should write this table. It will be better presentable. Okay, so first is Tdab or TD. It depends upon the type used. So routine schedule is you can give IM. IM generally intramuscular TD injection is given 10 and 15 years. Okay, then followed by once in every 10 years we'll give once in every 10 years. If you remember for your own self, if you have taken TT vaccine or TD vaccine, then you should count, is it 10 years done, then you should take every 10 years this TT vaccine. HPV vaccine, before 14 completed years, you will give HPV vaccine. The two-dose schedule 6 months apart. So this is a schedule like 0, 1, 6 month schedule or 0, 2, 6 month schedule. Okay, this is also given IM. Then influenza vaccine, it is given once in every year. It depends because seasons are coming in every year. So remember that kind of. It's also given intramuscularly and seasons appropriate single dose is given. Next, coming to conditional. These are essential. I already told. Tdap and HPV vaccine, influenza are essential vaccines. Conditional vaccines are varicella, MMR, typhoid, hepatitis A, B. Okay, all these are intramuscular injections. All these are intramuscular injections. So varicella, you give 2 doses at 1 month apart. MMR also 2 doses 1 month apart. Typhoid is a single dose. Hepatitis A is 2 doses 6 months apart. And hepatitis B, everyone know that hepatitis B is 0, 1, and 6 months. Like HPV, 0, 1, 6 months. Okay. Pre-conception period already told, Tdap and HPV is given. If you're giving MMR, you should give 4 weeks interval in that way. Okay. So special consideration for varicella is taken, like all non-immune women should be vaccinated and counsel to avoid pregnancy for 1 month if varicella vaccination taken. For chickenpox vaccine, 2 doses are given and 90% effective in preventing this disease. And several studies show that people vaccinated against the varicella has antibodies for at least 10 to 20 years after vaccination. Okay, and varicella vaccination after giving that there is sore arm, redness, rash after the shot, fever also is seen, and sometimes what happens is pneumonia, rarely infection of the brain, spinal cord, and seizures are often associated with fever. This is more severe reaction. Okay, now the topic of discussion is vaccination in pregnancy. It has repeated in many theory exams. It can again repeat. So vaccination in pregnancy, if the question comes, so see, pregnant women and the small fetuses are vulnerable population for severely affected communicable disease, right? So immunization is used to prevent the neonatal and maternal complication by preventing these diseases, passive transport of the transfer of the maternal antibodies, and thus narrowing that window of vulnerability. Okay, um, and these both mother and baby is protected from this disease. So discussion I already told that two important vaccines which are given in pregnancy. What is influenza? Other is Tdap, tetanus toxoid, reduced diphtheria toxoid, and acellular pertussis. Okay, so you should know the full form of Tdap as well. Tetanus toxoid, reduced diphtheria toxoid, and acellular pertussis. These are strongly recommended in each and every pregnancy. Okay. Mm, there is no adverse fetal effects on vaccinating pregnant women. Mm, Tdap vaccine. It's a combination vaccine that protects three bacterial infection. Okay. The Advisory Committee on Immunization Practices and ACOG recommends that Tdap vaccine in each pregnancy should be given, irrespective of their prior vaccination history. ACOG says, forget about the history, whatever happened, you should give to the 2 doses of Tdap vaccine here now. Optimal timing is 27 to 36 weeks. Okay, so ACOG says that 27 weeks to 36 weeks is optimal timing because it maximizes the viral antibody response and passive antibody transfer to the fetus. Even if the woman has 2 doses of TT, she can give see if she take 2 doses of TT, then she can give Tdap vaccine between 27 to 36 weeks, and no reported increase in severity of duration and adverse events associated with administration of extra tetanus vaccine. If this given, there is no adverse event occur. Uh, if a woman came, she delivered, and she said that I didn't get any Tdap or TT injection in my pregnancy, then immediately in the postpartum you should give 1 dose. And if we should also recommend that any person who is expected to be a close contact with the infant and has not received Tdap vaccine, then they also should get single dose of Tdap vaccination at 2 weeks before they have contact with the infant. Okay, even the person who is coming to see the infant, they also should get vaccinated. Okay, adverse effects of Tdap vaccine is pain at the injection site, erythema, swelling. Most will resolve in within 3 days. There is no association of harmful effect to the fetus or neonate. Okay, so vaccines in pregnancy, TD1 or TT1, this tetanus or the diphtheria toxoid, early in pregnancy we can give. So if you're giving TD only, then you can give in first visit. Okay, but Tdap is the one which is given at 27 to 36 weeks. Remember that. Okay, the single 0.5 ml IM, it is also single 0.5 ml. So if a person already have vaccinated, then you will give this Tdap vaccine at 27 to 36 weeks. Influenza is an activated vaccine. 26 onwards you can give. Okay. A single dose that is 0.5 ml IM. So this is very important. IM is the dose route of administration. Okay. Next is influenza vaccine. Influenza is a RNA virus with A and B serotypes. They have antigenic shift and drift. So they are causing endemic and pandemic flus. So influenza is H1N1. It increases maternal mortality by 25 to 75%. Okay. Compared to non-pregnant, pregnant women are more vulnerable. Okay. Fetal mortality is also high, like 30%. The inactivated viral vaccine contains three inactivated viral vaccine, that is trivalent influenza, 4 if it is the tetravalent strains, and it is recommended to administer these during pregnancy. This tetravalent has high safety profile because of there is absence of infectious viruses. Okay. It can be administered at any time during pregnancy or during the influenza season. Okay, this protects the mother from infection, and transplacental transfer of maternal antibodies also protects the infant from first few months of life. So the small baby, when it is born, there are more of influenza viruses in the atmosphere, so the baby can get influenza. So these antibodies protect the initial months. Protects the baby in the initial months. Okay, it takes about 2 weeks after vaccination for the antibodies to develop. So as early as possible, it is better to take influenza vaccine. Live attenuated influenza vaccine is also available, which is given intranasally, but it is contraindicated during pregnancy. It is contraindicated during pregnancy because there is placental transmission of virus to the fetus. There is risk. Hepatitis B vaccine during pregnancy. If a person who is at risk, for example, one teacher is there, okay, she's pregnant, and she's teaching two students, and it was found that one of the students is hepatitis positive. So, if there is any risk of transmission, then better go for hepatitis B vaccine. Okay. Uh, hepatitis, healthcare workers, sexual workers, these people are taking this vaccine. Then special consideration for varicella vaccine is like if she's not immunized or she didn't get varicella in childhood, then this person should be tested for antibodies, and they should be given this varicella immunoglobulins. Okay, because congenital varicella syndrome is more effective in the fetus. Postpartum, after delivery, also there is vaccination given. I already told if she didn't get any tetanus TD vaccine, then after delivery you can give. Breastfeeding is contraindication. Contraindicated smallpox vaccine is given. Okay. So these are vaccines in postpartum. I already told influenza vaccine is given a single dose. Then hepatitis B 016, hepatitis humanopapilloma 016. Okay, MMR is 0 and 4. varicella 0 and 4. We can give this. Even lactation, we can give all the vaccines like inactivated, live attenuated, recombinant vaccines, conjugate vaccines. Okay. Conjugate vaccines, I feel like it's all about influenza, like Haemophilus, pneumococcal, that way. Okay. Polysaccharides, pneumococcal typhoid, and even toxoids are given. Live attenuated are contraindicated in pregnancy, like yellow fever, smallpox are contraindicated during lactation. I mean, okay. Coming to elderly, I already told elderly also same. Tetanus and influenza is given. Apart from that, we'll give herpes and pneumococcal. Good. So routine vaccination schedule should be followed. So this is the thing which I already told: tetanus and influenza, herpes and pneumococcal. Very good. So these doses are given. All are given in IM. Okay. Special situations. I don't think is that important. Rabies vaccine can be given in pregnancy as well, if there is any situation created. COVID-19 vaccinations can be given, and talking details about this. That's it. Okay. I'll just repeat the thing so that it will be good. Okay. So, in introduction, there are about 3.5 million people suffering from these diseases. So, almost 40 million people have hepatitis B. So, you should go for vaccination, pre-immunization immunization schedule, and if the lady come for vaccination, you should choose the key points like if whether she have any temperature or any serious reactions, any blood transfusions, any immunoglobulins, if she's pregnant or not. Adults and girls will give hepatitis and diphtheria, tetanus, TD vaccine. It is very important. Other vaccines are all optional, but HPV and TD is vaccine given. In preconceptional period, if MMR is given, at least 4 weeks she need to wait to get pregnant. And vaccination adults and HPV, Tdap, influenza, other vaccines. Pre-pregnancy, you can go for Tdap and influenza. Along with that, we can give varicella, MMR, hepatitis B, and immunopapillomavirus vaccine. In pregnancy, only two things vaccines are given, that is Tdap and influenza. In postnatal, all vaccines can be given. In elderly, you'll give again Tdap and influenza. Other than that, it also an pneumococcal. Postpartum can be these people who are didn't receive Tdap, they can be given. Elderly, you give herpes and pneumococcal as well. Adults and girls is something like 10 to 19 years of your age, and these people should be given this hepatitis HPV, and tetanus vaccines. Other than that, we can also give hepatitis A and B vaccines. Okay, MMR vaccine, if it is given, then 4 weeks she need to wait for getting pregnancy. So these are the adolescent vaccines which are given, and all of them are given in IM dose. Okay, then other conditional vaccines are also there like hepatitis A and B. Okay, these are also given in IM dose. Preconception period, you have tetanus and HPV vaccine. Special conditions for varicella, they can give 2 doses of chickenpox vaccine. uh, the side effects are injection, sore arm, and all. Vaccination pregnancy, the window of vulnerability to be narrowed. So we'll give tetanus and influenza vaccine. There are combination vaccines of three bacterial infections. Tdap is only given at 27 to 36 weeks. And if she's not taken any vaccine, then she given immediately postpartum. If she have already received a tetanus in this thing, then she can get the Tdap at 27 to 36 weeks. Close relatives should also get Tdap vaccine. Okay, so TD is early in pregnancy, single dose 0.5 ml IM. Tdap is 27 to 36 weeks, will give it single dose IM. In influenza also 26 weeks, single dose IM. Influenza, because of antigenic shift and drift, there is high chance of transmission. The trivalent and tetravalent vaccines, tetravalent is best. Okay, there is 2 weeks, 26 weeks onwards will give. There is live vaccine, but should not be given in pregnancy. Hepatitis B vaccines are given who are at high risk. Varicella vaccine is given. Immunoglobulins can be given. In postpartum, smallpox vaccine should not be given lactating mother. Vaccinations, postpartum hepatitis B, influenza, HPV, varicella. Okay, contraindications in lactation, smallpox, and yellow fever. And in elderly people, you'll give influenza, Tdap, herpes, and pneumococcal vaccine. Rabies can be given in pregnancy, in special situations. In COVID, if I want to tell about COVID, um, This is the thing. Like the program expanded to vaccination frontline workers, citizens of more than 60, more than 45 years, more than 18 years, eventually children between 12 to 18 years. These people can get vaccinated, and use of these different vaccines are available in India for children between 12 to 18 years of age under the vaccine that is Corbevax. What is that? Corbevax is administered 0.5 ml 0 to day 20 through IM route. This is for children of 12 to 18 years of age. Okay, thank you.